don't get any closer.
Hey, listen. I know you.
Do not get any closer. Not get any
Okay.
closer.
All right. How are you? Good morning, everybody.
Thank you. Shall we be seated, please? Good morning, Your Excellency. Have the presidential launch of the Mahama Cares initiative, which is the Ghana Medical Trust Fund. I tell you something. Yesterday, a Jumara was launched. Today, Mahama Cares is being launched. Tomorrow, the National Apprenticeship Program will be launched. Tomorrow, relax. On Thursday, we'll have the Black Star Experience launched. At this time, you can do it. It is now my distinct honor to respectfully invite the Jumara, the Commander-in-Chief of the Ghana Armed Forces, the President of the Republic of Ghana, John Dramani Mahama. Please, shall we rise and give him a round of applause as he comes to state to speak to Ghana.
Thank you very much. I mean, very much our sister here. I mean, very touching. And maybe I'll make a few remarks before I inflict the official speech on you. It mimics almost exactly what the minister said. But I want to say I can empathize with what she's going through, because she's just one of many of our citizens and countrymen and women who are going through what she just talked about. And the perception was that if you were rich, it was a disease for the rich. Hypertension, cardiovascular diseases, diabetes were diseases of the rich. But increasingly, we see that it's inflicting more the persons who are much poorer and can least afford to be able to manage those diseases. And that's why the Ghana Medical Trust Fund has come at the right time. I have a personal connection to non-communicable diseases, and that is because my father died in 2001, and he died of prostate cancer. My mother died in 2016, and she died of complications of high blood pressure and diabetes. My stepmother died of breast cancer. I lost a friend and somebody who worked for me last year. We celebrated 1 year since she passed. I'm sure most of you know Mawena Dumo. She died of breast cancer. Everywhere with me, anytime I went back to the constituency, he was in charge of the southern zone, and so anywhere I went, he went with me. And a few years back, he started to have a problem with his kidneys. And so at the time, there was no dialysis north of Kumasi. And so if you had kidney failure anywhere above Kumasi, you had to travel to Kumasi to do dialysis. And so he used to travel from Wale Bamboy like once every week to do dialysis, go back, and the cost was unbearable. I tried to help as much as I could. Eventually, he needed more a dialysis treatment, and so he couldn't be going and coming. So he had to move his whole family to stay in Kumasi, rent accommodation in Kumasi, so that he could be close to Comfort Noche where he was undertaking the dialysis. Sold his motorbike, sold his TV, and much as I also tried to support, the cost was becoming unbearable. Eventually he died, and he died leaving poverty behind because he sold all his assets to be able to look after himself. And so we had to take care to support some of the children to be able to finish school and all that. These are real stories, and that is why what we're doing today is important, because they will touch a lot of lives and help a lot of our fellow citizens. But let me say that this program must be linked and will be linked to our primary health care project, which we are yet to launch, because under the primary health care, we envisage that there will be volunteers and designated community pharmacies where our citizens, wherever they live, or the chief compounds, will be required to go and take their blood pressure, check their sugar, because like was said by the UNICEF director, these diseases are preventable. And even if they have an onset, if you detect it early, you can have a favorable outcome if it's detected early. And so the primary health care would have community volunteers who will go from house to house occasionally, maybe every 3 months, every 6 months, and just take people's blood pressure, check their sugar level and all that. We'll have a program where women, are able to detect lumps earlier to be able to get treatment in case they are developing breast cancer, and so many of these other things. So I think there should be a linkage between Mahama Care and the primary health care program when we launch it. So we must also, as part of the Ghana Medical Trust Fund program, launch a very strong awareness campaign so that people will know what the trigger factors for these non-communicable diseases are. I understand that some of them are genetic because you can inherit it from your parents in your genes, but a far greater number are lifestyle diseases. They are acquired, they are not genetic. And so if people just know, what their disposition is and they are able to make changes in their lifestyle, I'm sure that we should be able to bring down, the level of disease burden that we currently are seeing. I want to thank our brother from Kalbag for the very good testament he made about the need for support by corporate Ghana in this particular exercise. And I want to encourage corporate Ghana, businesses, the mines, the banks, and all the other companies, that this Ghana Medical Trust Fund program is coming. Those it's coming to help are your clients who save their money in your banks. They are clients who do business with you. And indeed, they are not only your clients, they are even your own staff. Some of your staff have died, from breast cancers and diabetes and all that. And so, as part of your CSR, if you give anything, you are giving it not just to help people, but to help your own clients and your own, your customers and your own staff. And so, I'd like to encourage all corporate Ghana, that is private sector and state sector, to annually devote a portion of their community social responsibility to Ghana Medical Trust Fund, because we're going to do a lot of good to our country. I want to assure Prophet Adanu that while he was speaking, the many suggestions he was throwing out, I turned quietly to the Minister of Health and asked, "Are you taking notes?" And he quickly took his paper and started writing. So, Prof, you can be sure that note has been taken on the suggestion you made. And we want to thank you for that. I want to thank Professor Aite, who's been my long-standing friend and mentor for the contribution he made. Prof. Aite is a retired specialist, emeritus professor, and very well known in medical sectors. And so when he gave the envelope, I mean, for a retired pension, medical professional, I was curious to see how much he had given. And so after I took the check, I gave it to the health minister. But after a while, I collected the envelope back and I peeked at it. And he won't want me to mention it, but I want to say that I was surprised at how much he's giving. A doctor on pension has given $1,000. And so that should encourage all of us and encourage, the corporate institutions to do even much better. But on that note, I also, as the initiator of this laudable program, would also have to give something. And so I've pledged half a year, 6 months of my salary. I'm not yet being paid. They say Accountant General is still doing something. But whenever Accountant General finishes, 6 months of whatever I'm entitled to will go into my hand. So thank you very much. Now let me inflict my speech on you. Mercifully it's short, so you won't have to live through too much pain. Yeah. So I am deeply honored to join you this morning for the official launch of the Ghana Medical Trust Fund, Mahama Cares, as it's called, a landmark initiative introduced by my government to decisively confront the growing burden of chronic non-communicable diseases, for short NCDs. The fight against NCDs is intrinsically linked to our broader national development agenda, particularly the Sustainable Development Goals, and most notably SDG 3, which enjoins us to ensure healthy lives and promote well-being for all at all ages. Specifically under SDG 3, Target 3.4, commits the global community to reduce premature mortality from NCDs by 1/3 by 2030 through prevention, treatment, and promotion of mental health and well-being. Across the globe, non-communicable diseases, including cardiovascular diseases, cancers, chronic respiratory conditions, diabetes, and mental health disorders, remain the leading cause of mortality, accounting for over 43 million deaths annually worldwide. Worryingly, the burden is disproportionately borne by low and middle income countries such as ours, posing not only a public health crisis, but also a profound social and economic threat. Non-communicable diseases exacerbate poverty, they widen social inequality, and undermine economic development. Vulnerable populations, that is those with lower education, limited access to healthcare, and lower income levels, are currently most at risk. Addressing the NCD menace is therefore not merely a health imperative, it is essential for advancing economic growth, promoting social justice, and securing environmental sustainability. In Ghana, the picture is equally alarming. Available data indicates that NCDs amount for over 40% of all age category mortalities, and they consistently rank among the top 10 causes of death nationwide. Even more disturbing is the steep rise in hospitalized cancer cases, which jumped from 3,487 patients in 2012 to 16,105 in 2016. Alarmingly, adults aged from 18 to 45, the prime of our nation's workforce, account for more than half of these cases, 16,000 cases. This troubling trend is driven by a convergence of factors. One, shifting lifestyles characterized by things like tobacco use, alcohol abuse, unhealthy diets, and sedentary behavior. and also increased environmental factors. The cost of treatment, ladies and gentlemen, is not just disturbing, it can be devastating for low-income families. Estimates from our teaching hospitals reveal that the average annual cost of non-communicable disease treatment per patient averagely stands at approximately 53,000 Ghana cedis annually, and that's equivalent to about $3,300 US. Managing chronic conditions imposes crushing financial burdens on families, often pushing them below the poverty line and deepening their vulnerability. It is estimated that individuals diagnosed with chronic diseases face a 75% likelihood of falling into poverty within 5 years, regardless of their original economic standing. And so it even ruins rich people. I mean, you spend all your money trying to find a cure. Those battling kidney and cardiovascular diseases are reported to spend between 70% and 95% of their non-food expenditure on healthcare alone. Older adults living with chronic conditions spend 5 times more on healthcare than their healthier counterparts. Despite the important strides made through the National Health Insurance Scheme, it remains inadequate in fully covering NCD-related services and medications. In 2018, around 48% of all NHIS claims were related to non-communicable diseases. Yet essential services remain outside the NHIS coverage, leaving families dangerously exposed to out-of-pocket payments. It is against this background that shortly after my election as President, I directed the Honorable Minister for Health to initiate the establishment of the Ghana Medical Trust Fund, a commitment captured faithfully in the 2024 People's Manifesto of the National Democratic Congress. Following extensive consultations with inputs from over 3,300 stakeholders, the National Task Force I formed, ably chaired by Reverend Emeritus Professor Seth Aite, submitted its final report on April 10th this year. I'm pleased to inform you that the accompanying draft bill, as the Minister said, is ready and will be presented to Parliament when it resumes at the end of next month. Ladies and gentlemen, today we're launching more than just an initiative. We're launching hope. Hope for thousands of Ghanaians living with chronic diseases. Hope for families battling the overwhelming cost of care. Hope for a future where the quality of life is not determined by one's ability to pay for essential treatments necessary. The Ghana Medical Trust Fund will support specialist-level treatment for a range of chronic diseases, including cancers, diabetes, cardiovascular diseases, chronic kidney failure, stroke, and other complications. It will also progressively expand to cover convalescent care, palliative services, and home-based support. Support from the fund will be based on formal applications, carefully vetted, and will focus on costs not currently covered under the NHIS. The fund will operate as an independent statutory trust, governed by a board of trustees and supported by a dedicated administrative secretariat, third-party administrators, and patient navigators to ensure transparency, efficiency, and a patient-centered service ethic. Initial projections suggest the fund will require approximately 3 billion Ghana cedis annually over the first 3 years. And as was said, the main source of finance is going to come from the NHIL, the uncapped portion of the NHIL. It will also include direct budgetary support from government, voluntary contributions from corporate institutions and individuals, grants, donations, and will also be able to invest in order to raise income, investment income. Strategic procurement measures such as access pricing and framework contracting will ensure that essential medicines and diagnosis are acquired sustainably. And so I spoke to the minister and asked if we couldn't encourage our local pharmaceutical industries to increase the availability of generic drugs, which are much cheaper than the imported drugs. I know because I paid for my mother's diabetes drugs, and I know the difference between the imported drugs and the difference in cost. And so if we can encourage our pharmaceutical industry to produce generic versions of those drugs, it will bring the cost much lower. I wish to commend the exceptional leadership of the National Technical Task Force, chaired by Reverend Emeritus Prof. Seth Aite, and to extend my heartfelt gratitude to all the professional associations, religious leaders, our development partners, and citizens who contributed their expertise and passion to bring this initiative to life. Your dedication has translated a manifesto promise into a tangible, life-changing reality. On that inspiring note, distinguished ladies and gentlemen, I'm proud to officially declare, is there going to be a fanfare? Let me know. The last time when I was just declaring something launched, then I almost ran away from the stage. Okay, there's no fanfare. All right. On that inspiring note, distinguished ladies and gentlemen, I'm proud to officially declare the Ghana Medical Trust Fund, into brackets Mahama Cares, duly launched. May God richly bless all of us, and may God continue to bless our homeland. Thank you very much.
Well, there's no Papa. Please, you can take your seat. But
All right. I'll be back. Okay, take care. Thank you all very much. Thank you. All right. I'm most grateful. I'll be inside. Okay. Take care.
Thank you. Daroma, your plan. You're a Mahama, time where you campaign, your Haniche, Obokotobi, Chabokoya, Beboye, Bafuche, Idiotche, diabetes, more than Apollon, your bra, our new meeting, police Capumbandan, police Caman Hospital, chair, to be able to prepare for car, so many. I made our own end, I've been doing the in the sky, and then the pilot drop walk on any attempt to sway the other way.
So you have a better okay, sir. Message from for concerning this policy.
When we come to Ghana, the other chair, we are Boka. Baba, you know that. Chair, say la, Liangua Bogusinwa, Master Yes, yes, such a Bia Boka. So I when you're in the yearly view, you hypertension, you diabetes, you like my Bendo, a young human being, you take chest so yes, sir. The come on.
Who said that?